From quality primary healthcare after the official opening of 2 state-of-the-art clinics in the province. The clinics, worth over 30 million rands, are part of the National Health Insurance, the NHI program, which aims to provide quality healthcare to citizens irrespective of their socio-economic status. Eastern Cape Health MEC Helen Sauls-August opened the clinics.
Today we are in Zabasa village, where the MEC for Health in the Eastern Cape has opened a state-of-the-art clinic to the tune of 17.5 million rands. She will also be opening another clinic in another village which cost around 18.5 million rands. We do have the MEC for us here, who will be explaining to us about this NHI program and what it entails. MEC, good day and welcome to SABC News.
Thank you so much for having us on the show.
Thank you. Please explain to us about this NHI program and the importance of opening this clinic, especially in these peripheral areas.
Well, obviously, I think the first thing that we need to understand is that NHI sets certain norms and standards where you would want your facilities to be. And as the African National Congress, we also have a duty to ensure that there is universal health coverage. That means that each and every member of the community have got access to quality health care where they are staying. In pursuance of that drive and that vision, we are then called upon to make sure that our facilities in our areas comply to the norms and standards in terms of infrastructure. That is why we have this beautiful clinic here in this rural area today, where we also have, at least for now, the minimum number of staff that is already attracted to the clinic and attached to this clinic so that the quality of service can be run out. So that is all in compliance to make sure that when the issues at the national level, when the NHI fund kicks in eventually, when those issues have been dealt with, and when the contracting is going to start with certain of facilities, we know that our primary healthcare facilities are already at the level that even those in the private sector might want to utilize at that stage. So that is why we are having, people must understand, NHI there is for our hospitals basically to compete at that same level with our private hospitals. So it's not only the primary healthcare, it's our district hospitals, it's our regional, our tertiary and our academic hospital that we've all brought up to par to make sure that when NHI is pronounced that they can compete in that space. The district is where the universal health coverage will take place. This is where we must render a quality service to our communities and where they at least need better facilities than what they have had in the past.
Okay, let me see. Also, speaking of those quality services, what are some of the services that are likely to be offered at this clinic?
Well, obviously, in all our primary healthcare facilities, you must have adherence to the HIV/AIDS and the TB. It's one of those issues. All diabetes, high blood pressure, the pregnancies will also be dealt with. Infants, the immunization is a major component there of our facilities, and making sure that we then attend to all of those. Also, our mobile facilities that usually runs from our clinics to our far-flung is also one. Ward-based outreach teams is a critical component of our facilities, where we have our community health workers going out doing physical visits to some of the homes and picking up these people that are defaulting on certain of these kind of treatments.
Okay. Also, we'd like to call on the community to maximize the use of these clinics.
Definitely, we want them to come. We want them not only to come and to get a service, but we want them to own this facility. It can't be, and we will never condone where people might be unhappy about a road or unhappy about a school, that they would come and then violate and vandalize our facilities. So in handing over this facility to the community, that is always what we preach to communities. Take ownership of the staff. Love the staff, respect them, and then obviously there is a two-way in terms of then your community will also be better served. But I am very confident. We have a very vibrant clinic committee that is here. We have a development agency from the municipality. The ward councillors in the area, surrounding the area, are really supporting this community and the facility there. And so I am, with an open heart, I'm handing over this clinic to the community here today.
MEC, we know you are still rushing to another village. Thank you so much for your time.
Thank you so much. God bless you.
All the best for the time. Well, that was the MEC for Health in the Eastern Cape, Ms. Helen Sauls-August, saying, of course, they want to provide these quality healthcare services to the people in the rural areas, irrespective of their socio-economic standing. From myself, Atule Joga, it is back to you in studio.